Hi, everybody. Welcome to the News 13 Coronavirus Virtual Town Hall meeting. I'm George Roberts.
And I'm Marie Johns. On the show today, we're going to be talking to doctors and a leader in the tourism industry, but we're going to start with two local legislators.
Joining us now on the broadcast, State Senator Mario Scavello, who has Monroe and Northampton counties, and State Representative Doyle Heffley in Carbon County. Gentlemen, thanks for being with us.
Thank you for being here with us.
So it's a difficult time out there for everyone. As our leaders, what do you want people to know? Mario, you start. Tell us what you want people to know in this difficult time.
Well, you know, one of the major concerns here in the county has been the March busing, and they feel that we're bringing more people up. And I just want you to know that I've been in contact with the owner of March Trailways for quite a while. And we had a discussion today, and in all the times that we've been talking, he said it's been between 16 and 20 some odd people. They're half buses, and then most of them are emergency medical people that he's bringing in, nurses, emergency medical. As of Friday, he's going to stop service to New York for a period of 2 weeks. And the reason why he's waiting those 2 weeks is because he does not want, he wants to give these folks a chance to figure out how they're going to commute to New York. It's been a major concern here in the county, and I've asked the governor as well to reiterate what President Trump said yesterday and what the governor in Florida has done, that if you're traveling from New York into Florida or into PA, you have to voluntarily, it's going to be a mandatory, for 2 weeks you have to stay at home. You can't go out into the public.
Well, Mario, what I see, though, is this is an issue because you're talking about essential workers that, you know, unfortunately they live out here and they chose to live out here for a reason, but they're essential workers that have to go into New York.
I understand that, but here's the issue. At some point, and he's telling me he brings back the same amount of people. There's not new on that bus. Mm-hmm. But, you know, he's getting a tremendous amount of complaints, and people don't understand it. And I've been saying this from day one. But so he's going to give them time to, you know, a couple of days. And look, he's losing his shirt doing it. But he's been the bad guy all along. And you know, I didn't want to push the envelope with him. I just wanted to make sure that this is what he did voluntarily. And so he's going to give him a couple of days to notice. I agree with you, George. And I know those folks, because when I had the bagel shop, the stop used to be right in front of the bagel shop. And during September 11th, I saw them all the time. They're on that bus all the time. Right. You know, they're coming back or whatever. They'd stop in for a cup of coffee before they went or on their way back. So I don't know the answer here. But remember now, with the quarantine, the governor is going to do if you're coming from New York into Pennsylvania, you have a 2-week quarantine, and I've asked the governor mandatory quarantine. By doing that, it hopes to slow down that traffic coming in. And what I'd also like to see, and I've asked them, the PennDOT boards on 78, 33, 80, and 84 put that mandatory quarantine for people visiting from New York into Pennsylvania. Okay. We have no choice. No. New York is the epicenter, but it looks like Monroe is going to be the Pennsylvania epicenter unless we take some firm, you know, steps. And I think it has to happen. Okay. All right.
Absolutely.
Thank
you, Mario.
Now, Doyle, Carbon County, obviously, it's coming our direction, too. The numbers aren't quite there as what we're seeing in Monroe and obviously New York City. But what do you want the people here to know?
Well, I think the most important thing is don't get a false sense of security. Right now, we're not seeing the numbers, but we just really started testing. And it's important that people understand that the numbers that we're seeing are generally 3 to 4, if not 5 days behind because of the time it takes to be tested and get those results back. The number one thing, and I talked to our county emergency coordinator, the office is up and running. We're working with our first responders, getting the equipment out that they need. To them to, you know, continue to provide those safety services. But the number one thing is if you don't have to go out, stay home. The best way, what we really need to do is starve this virus so it doesn't keep more and more people getting sick.
Okay, we seem to have lost Doyle. Oh, there he is.
Okay. Our hospital systems are handling what they have right now once. So very, very important to stay home and not go out if you don't have to.
Okay. All right, Doyle. Having a little bit of problem hearing you there, but I think we're okay right now. For both of you, Mario, let's talk about our proximity to New York City. I mean, this is probably one of our biggest problems is this proximity of Monroe County, correct?
First of all, there's about 20% of the homes here in Monroe are owned by New York, New Jersey, Philadelphia residents, and there's summer homes for them. If they just decide, hey, we're going to go to our summer home until this cleans up in New York. So everybody sees these New York places and they get all nervous. But the truth be said, that's the problem. We are local. They have summer homes here, so they go and shop and they'll be buying like 6 loads of toilet paper or whatever, and people say they're hoarding. They're going to be here for a while. It's their house.
Absolutely. Well, if the buses are going to stop running, as you're saying, some of these people are going to have to make a decision as to whether they're going to stay here and shelter and stop working, or stay in New York where their jobs are and continue being an essential worker that is, serving the need in New York City. Is that what you see happening? Decisions?
Yeah, and I think the decision's going to be for them is they're going to have to stay down there, because even when they come back to PA, according to the governor's order, they have to, for 2 weeks, they have to quarantine, because they've been in New York. So the best is they're going to have to stay. Look, we're going to all have to make some sacrifices. Doyle said it best. You want to starve this thing. You don't want to continue to give it more food, and the only way you're going to give them food is more people, and more people bringing it in. So, and if we don't do it now, we're going to be paying for it on the back end. And Doyle's right; those numbers are going to continue to spike. We are behind, but I have a positive feeling that that this virus might have the antibodies, and also the trials now on that malaria medicine, that they feel that it's going to work. I know that they're using it in New York now. It was positive in Paris. So let's keep our fingers crossed that does work, and I think then we really are in good standing. What we have done, and the House did it, and we're doing it today. We put some emergency packages in to help small business. Small business is very, very important, and I always say, whenever I go to a ribbon cutting, if every small business hired one person tomorrow morning, there'd be no unemployment in the country. We have to protect those small businesses. There's going to be some up to $100,000 loan that they don't have to pay a nickel for in the first year, and it's zero free interest to help them get back. There's also, through SBA, Small Business Association, there's money there to help pay your employees to keep going. So we have to help the small business. The federal package hopefully will pass, because you just can't forget about people. There's a lot of folks that are paycheck to paycheck, especially in Monroe County. You lost 3,500 jobs just in the water parks alone. 3,500 jobs. Now, some of the water parks people, Kalahari, gave everybody a two-week salary when they closed, and hopefully they're hopefully saying that within that 2 weeks they'll be back. But I think it's probably going to be a third week.
Yeah.
But we are doing what we can. Just people stay at home. If you don't have to go out, the governor is also, by the end of today, Northampton and Lehigh County will have the same as Monroe County. The governor is going to stay at home for those two counties as well.
All right. Doyle, I know that, in Carbon County, of course, we have a lot of small businesses too, and I'm sure that, they're feeling the pinch now. And how long do you think, you've been talking to people, how long do you think they can survive without work?
Well, right now, and I would we're actually virtually voting in Harrisburg today. We're going to be going back onto the House floor in a short while. As Mario said, we're working right now on an unemployment comp bill. There were 500 and some thousand claims issued over the last couple of days. So the state is processing those. It's going to take a little bit of time. We're waiting to get guidance from the federal government as far as what money's coming back to get that unemployment out to those folks. They're going to be able to continue to pay their bills. In the meantime, we'll be voting today on a bill to move the primary from April 28th back to June 2nd. And one of the big reasons is a lot of our poll workers are senior citizens, and they just are not going to be able to be out working the polls, and we're not going to have the turnout that we need for that primary election. We're also looking at a critical funding bill to help sustain our hospitals. And I got to commend St. Luke's, Lehigh Valley, and all the hospital networks across the state, and the folks that work in those hospitals. I know I hear from a lot of people that they don't want to stay home. I'll tell you who would like to stay home. The doctors and nurses that have to go and are working on the front line. And the best thing that we can all do is not get sick. So if we stay home, we're not going to spread the disease. The hospitals won't get flooded. In the meantime, today we had a blood drive because there's an urgent need for blood in Carbon County, and all the slots were filled up. We're going to do another one. People are coming out. People are sewing masks right now for the hospitals. I've had businesses throughout Carbon County donate the much needed N95 masks and personal protective gear to the hospital network. And if there's other businesses out there that see this, they can donate that stuff as well, right to the hospitals. They share it amongst, there's no competition between St. Luke's and Lehigh Valley or Geisinger at this time. It's all about, getting the supplies to the people that are needed. But if you don't have to go out, if you don't have to travel, the best thing you can do right now is to stay home. That's the best thing you can do to protect those healthcare workers on the front line.
Great advice. A time of hope and things springing up out of desperation, really, and all of the things that we are being told to do. Hope is essential right now.
Yeah, we're working on a package of bills in Harrisburg between the House and the Senate and the governor's office. The governor is issuing waivers to businesses and companies. One of the things we need to do is the less people that get sick, the quicker we get through this, and we got to get our economy going again. It's vitally important that we come out of this and rebuild after this virus goes through here. But we have a package of bills that we're working on right now. Everything from help for hospitals, unemployment compensation, suspension of different medical regulations, and also driver's license and regulations since the DMV is shut down. So we're working through a lot of those, and we're also helping businesses that are actually producing right here in Carbon and Monroe County, businesses that are producing pieces and components that are needed by Precision Medical and B. Braun to make the much needed ventilators and respiratory systems. So if anybody out there, they have a business and they're a vital business and they need to stay open, contact our office. We'll help them work through the process to get a waiver. My staff is working remotely. We are here. Our phone numbers are listed, email, and we're going to help the people throughout the 122nd district get through this together.
All right. Mario, I'm sure your office also is open. You're still doing business.
Yeah, I think I've lost you, but you still, can you hear me?
Yes, we can hear you. Yep.
Okay. Yeah, my office has been open every day, but we have the front door closed because we don't want to spread anybody coming in. I have to protect my workers. But we've been very busy. The phones have been very busy. Doyle touched on it just briefly, but I have to tell you that that unemployment bill is so important because people can apply from day one. Normally you got to wait. Plus the businesses are not going to be they're not going to be charged for those increases in unemployment because the layoff was because of the virus. We're working as close as we can with the municipality, county, and the of course emergency services. But I, like Doyle, would like to truly compliment the healthcare workers. Unbelievable. We're blessed with one of the best health systems in the country, and we've got something to be very proud of.
Well, gentlemen, we want to thank both of you for being with us and taking the time out of your busy day to join us on the broadcast. We know there's a lot going on in Harrisburg. Just keep us informed, and we want to make sure everybody knows at home what's going on. Thanks for being with us.
Thank you. Thank you very much.
We'll be back with doctors from both Lehigh Valley Health Network and St. Luke's University Health Network. Joining us now are representatives from both of our local hospital systems, both St. Luke's and Lehigh Valley being represented. We have Dr. William Markson from St. Luke's Lehighton campus. He's the medical director there. And Dr. William Coors, the chief medical officer of Lehigh Valley Hospital, Pocono. Welcome, doctors.
Great to have you both with us. And let's start off by talking about what's happening in your hospitals at the moment. Dr. Coors, let's start with you. What's happening that the public should know about right now?
Well, first of all, the public should know that we are here 24/7 for people that have really severe symptoms and are concerned. And we'll talk about some of the other options that are available short of that. But be rest assured that we have taken every guidance from CDC and the Pennsylvania Department of Health. We've put protocols in place. We're trying to ensure the safety of our patients, of our staff. We've limited visitation in conjunction with St. Luke's. And we continue to monitor an ever-changing situation, as sometimes the guidelines, quite frankly, change from day to day, and sometimes even more frequently than that.
Dr. Markson, how about you? What's happening at St. Luke's?
You know, St. Luke's, we're doing many of the same things that my colleague Bill just spoke about. We have a command center that communicates with each of the campuses on a daily basis, sometimes more than once a day. We have group huddles at each place. We are constantly updating our intranet so that everyone's reading our daily newest guidelines. We as well are, of course, following the CDC guidelines, and we're trying to make everything safe for our healthcare workers and for our patients. And we want to assure everyone that we are doing everything in the most right way, in the most safe way. And this is a serious issue going on, but we want to make sure everyone is still calm and making good decisions, and also reminding people that although we have to do a good job now, we know that eventually, and hopefully sooner than later, we'll get back to normal.
For the person sitting at home, I think the biggest thing on their mind right now is if they start not feeling well, what should they do? We've been told to stay at home and isolate. How do we know when it's time to call and ask for help? Dr. Coors, can you start, please?
So this is a very commonly asked question. So if somebody thinks and is concerned that they have symptoms that may be consistent with COVID-19, our initial advice, quite frankly, is to stay home. We have a resource at website LVH-Pocono. Patients can be directed to a telephone call where a nurse can triage their symptoms. Patients can be directed to video visits. And if the patient still feels that their symptoms are more severe, we do have express care locations throughout all the regions served by Lehigh Valley Health Network. We would ask, however, that if somebody really thinks that they need to be seen, that they call ahead. The numbers are all on the website at lvhn.org. To alert staff that they would be coming in, and so that we can take the proper precautions both with the patient and our staff. And then finally, as I mentioned earlier, if for patients with really severe symptoms, obviously the hospital emergency room is available 24/7. But once again, a very prudent thing to do would be to call ahead so that we can be prepared when a patient arrives.
Dr. Markson, I assume St. Luke's is doing much the same?
It sounds like we've been going to the same meetings, which I'm glad to hear. And let's face it. I think that our region is blessed with two very high quality, high level hospital health networks that take the health of the community as well as the individuals very seriously at a very high level. We, of course, have a similar system. It's 1-866 St. Luke's or 785-8537. We have a call-in system. We'll have a hotline. You push option 7, and if you don't have a primary care physician, we will direct you in the right way. As well, to remind everyone that if you are not sick we're still trying to garner and save resources a little bit. I'm sure that it applies to Lehigh Valley Health Network as well, so that those who may have the illness but are not sick, they're better off at home unless they are developing cough or fever, or shortness of breath, of course.
Well, Dr. Markson, let's assume, okay, if I'm not feeling well, and I don't know what, I just don't feel well, should my first call be to my family physician? That's where I start?
Absolutely. That is for sure. For sure. And, they have, in addition to their own knowledge, they have a checklist of questions to know whether this is the item that you're concerned about. And, of course, you have to remember that as we've all been watching the news, there are plenty of people who are walking around who barely have symptoms or don't even know they have anything, and turn out to be positive. At least not so much in our area, we don't think, but that is likely to come to that as well. And we are trying to not have our emergency room, urgent care, and hospitals inundated. We don't want people who are not that sick to be infecting others. So there has to be a little bit of a balance between when someone seeks direct care and when they stay at home feeling not so well but not awful either.
Right.
How about the workers in both of your facilities? I mean, obviously, we're doing the social distancing, the hand washing, the sanitizing, trying to keep it from spreading. How are your workers doing through all of this? Because it's got to be a difficult time for them as well. Dr. Markson, would you want to start?
Yeah, sure. Our healthcare workers, although they are trained, they're people just like everyone else out there, and there is fear, but they're trained in what the protocols are. And our protocols are changing on a daily basis. In fact, just today, we went to a universal masking protocol. So we've all been hearing from Dr. Fauci on TV and others that masks don't protect everyone, but despite that, as there is more and more community spread and we understand the droplet and airborne aspects of this spread, we are going to universal masking. So all of our healthcare workers are wearing this as of today. And the reason is we may be, just like anyone else, have a chance of being infected. We don't want to infect any of our patients who are coming for unrelated issues, as well as to send the right signal to the community that we're cautious. We want to protect our workers, and we want to protect all of the patients.
Absolutely. Dr. Kors, how is your workforce doing?
So I'll echo what Bill said, that, our staffs are human. They have fears and concerns like anybody else. But what I have found time and time again is that when there's a real crunch and when people need to come together and work as a team collaboratively, especially when we're dealing with a situation where we're basically writing a book day by day as we go along. Our staff has been remarkably resilient. We're extremely proud of them. And to echo Bill's comments, we also are going to universal masking with patient-facing services. Wherever possible, we've been trying to collaborate with St. Luke's on visitation policies. basic care policies so that there's no confusion in the community. And regardless of where someone ends up, they're going to get high quality, safe care. I think the community needs to know that.
Okay.
Absolutely.
Dr. Kors, a question that we've had from some of our viewers. If I'm an essential worker and I have to go into work, and and then I come home, like maybe I work at a grocery store or the Towihan Army Depot, something like that, and I come home to my family, should the family be taking any precautions? Should we be taking any sort of precautions in the home? Should we be doing things any differently?
So, boy, that's a very complex question. The simple answer is, as long as people are practicing basic good public health hygienic measures, washing their hands, making sure that coughing and sneezing are controlled, we don't feel that there's any greater risk to one's family. We are constantly monitoring our employees for exposures to different patients. We have systems where we grade them as high, medium, or low risk. But even on the patients where they're home, maybe monitoring to see if they're positive, again, it's just basic hygienic measures with their family. Is there a risk? There's a risk in everything, but we don't think it's a high risk.
Okay. Dr. Markson, what is the latest on the reason this is different than every other illness, the regular flu, everything else that sweeps through at different times of the year? What's the latest on why coronavirus is different and that we have to take all of these extreme precautions?
To me, the biggest difference, well, there's two things. One is it really seems to be spreading quite easily. But the other is that the likelihood of becoming very ill, although it's still not likely, it's much higher than other illnesses. And in particular, you can compare it to flu, which spreads fairly easily. Of course, there is a lot of herd immunity for flu. There's a vaccine that everyone takes every year. We don't have any background immunity in our community. There is no vaccine, and flu also can make people quite ill, but this seems to, as far as we could tell, this seems to make people more ill on a higher percentage of basis. The percentage is still low, but when you are infecting millions of people, a low percentage of becoming very ill is still a very high number.
We mentioned earlier that there could be people walking around that have coronavirus, but they're not showing really any symptoms. They don't even know it. And we don't want to scare people, but what do you think the percentages are, Dr. Markson, of people in the area that may actually have it we don't even know about?
Well, I think that we're probably a little bit better off than some of the places that we're watching on television. And that is because, we're not as densely populated. All infectious disease is going to be worse in a more densely populated area. And that's true for all sorts of epidemics through time, smallpox, tuberculosis. Dense housing really multiplies this disease. The more rural you are, the better. And, even within our catchment areas or your viewing areas, there's probably a little bit of differences between how many people are spending time in densely populated areas. Parts of Monroe, there's a lot of workers that are commuting to New York City, for example. And I think Monroe is going to have more patients than perhaps Schuylkill County or Carbon County. Mm-hmm. So I think those are the big factors here.
Dr. Kors, what about risk to children? Are we finding anything different or anything new on that? Originally, they were saying that children, were very resilient to this. What's the latest on that?
I honestly don't think that there's enough data to answer that question accurately at this point in time. It does not appear to be the typical bimodal distribution for a lot of viral illnesses that you see affecting very young people and affecting very old people. It seems to have a different demographic. And I'm not trying to duck the question, but I honestly don't think that we have enough information to answer that. I believe that as we do more testing and we start to identify the demographics of the age groups involved, we'll be better able to handle that.
Okay. Dr. Kors, we've talked about the big three, the sanitizing, the hand washing, the social distancing. Those are three things that we keep driving home to people. Is there anything else that people should be doing?
Keep doing it. I think what happens is after a while, you say, wow, I'm really getting tired of this. I'm gonna go to a party, or I'm gonna go do something silly. Don't. You got to keep the vigilance up. And I think the whole point of the social distancing, to echo Bill's point, is that it appears to be a very contagious disease. So if you keep the social distancing, you control your droplet secretions through coughing and sneezing, and you wash your hands. And I know everybody's into hand sanitizer, but don't forget, good old soap and water for 20 to 30 seconds will kill the virus very effectively because of a protein coat it has on it that just is extremely susceptible to the detergent properties in soap.
So, Dr. Markson, are you of the same mind? Are we on the right path with all of these things that we've been asking people to do, and do they just need to hang in there and keep on doing them?
Yeah, I am fully in agreement. I just want to add one term which I think is useful, and I think the terminology social distancing, I would like to flip it to the term physical distancing, because let's face it, all our happiness is, or much of our happiness is dependent on our interactions with each other, and we don't want to be socially distant. We want to be physically distant from each other. So I think that would be a nice flip.
I love that. I love that idea.
Yeah, that's a good point. I know the president had said he'd like to see business get back to normal by Easter. Dr. Kors, we'll start with you. Do you think that's possible?
Oh, brother. So I once again have to say, I don't think we have enough information. That is certainly a noble goal, and certainly the economy is taking a pounding, and we get it. And honestly, right now, I'm taking one day at a time. I don't know what's going to happen tomorrow, no less by Easter. So I think as this evolves, particularly in areas that are being hard hit right now, like particularly in New York City and the suburbs thereof, we watch what's going on in those communities with a much higher incidence of the disease. Perhaps it'll help guide us. And to Dr. Marston's point, the rural or the less congested nature of the counties that we serve may be protective, although, as was also pointed out, we have a lot of people from Monroe County that commute into New Jersey and New York every single day. So that physical distancing, I think, needs to be maintained for a bit until we have a better handle on what's going on here.
Right, good point. Dr. Markson, what do you think? Can we get this wrapped up in a few weeks?
Yeah, well, I just got off the phone with my good friend Tony Fauci. No, I'm just kidding. But, I think one thing that is proper is to remember that this won't last forever. And we can all get ourselves, especially if you watch a lot of television, thinking that the world is going to end and it will never come back. And I for one think that having hope and a concept that it's going to be over is good. But I think it's too early to know whether Easter is the right day or whatever. I'm not an epidemiologist, but it seems too early to call, shall we say.
Absolutely. Okay. How important is the money that could be coming from the federal government to help other businesses, hospitals as well, I'm assuming? Is that something that's greatly needed at this time to keep everything going?
Yeah, absolutely. Hospitals are somewhat strange businesses. They take care of lots of people who are ill. They lose money on certain things. They make money on other things, and it all washes out in the end so that they can be available for the public good. And right now, no one's having bariatric surgery and having knee surgery because they have a little twinge. So the hospitals are really serving the community really for its most dire health needs. And that's what they're here for. And it's great that we have these two great networks and institutions, but they both networks, I presume, will really be in dire financial over the long term. I shouldn't say dire. They'll be financially very, very uncomfortable without swift intervention from the government. It can't go on like this forever. We have a lot of people to pay, and who are necessary for the good of the community, and it'll be required.
Mm-hmm. Dr. Kors, what's Lehigh Valley's take on that?
So what a lot of people need to understand is that it is an extremely expensive proposition to be able to offer health care. It's very labor intensive. It's very technology intensive. It's very driven by a number of financial factors that become quite complex. To Dr. Marston's point, the general feeling is that most U.S. hospitals are going to be hitting some kind of financial hit because of this coronavirus situation. And it would be our hope at the end of it that there is some financial relief so that not only our health system, but health systems across the country can continue to do what they do every single day, and that's to take care of all comers.
All right. Gentlemen, one last question. We've heard that the hospitals need some personal protection equipment, masks, things like that. What can we tell the community that your individual health networks need? Dr. Kors, we'll start with you. Anything the community can donate or give to you guys?
Okay, I'm sorry, was that directed to me?
Yeah, we'll start with you, Dr. Kors.
Oh,
yes.
Okay.
Sure.
So, of course, so the kind of things that we would be looking for are personal protective equipment in the form of masks, gowns, gloves, hand sanitizers, things along those lines. And we are going to be putting out some very specific information about where those donations can be directed. We appreciate the outreach that we've already seen from our community, both individuals, corporations, other businesses here in Monroe County have really reached out to us in a very helping fashion, and we truly appreciate that.
Thank you. Dr. Markson.
Yes, I'll back up my friend, my new friend Bill here as well. We have a very similar setup. You can go on our website, slhn.org/COVID-19, and there is a way to connect with us.
Yeah, thank you, Bill. Thank you, because anybody that wants information can also use lvhn.org. It's probably a very similar thing to what St. Luke's has set up, to kind of offer information and help direct donations and all that kind of good stuff.
All right, Dr. Markson, I think we lost you there for a moment. I don't know if you had any last word.
Okay. All right. Well, thank you, doctors, for your time today. We know you're busy. We all got to get back to work, so thank you.
All right. Stay calm, be well, and we'll get over this.
We will. Here are the websites for both of those hospital systems so you can get all of the vital information you need.
Coming up next, we'll be talking to Chris Barrett from the Pocono Mountains Visitors Bureau about how the coronavirus has affected the tourism industry.
Joining us now is Chris Barrett, the Executive Director of the Pocono Mountains Visitors Bureau. Chris, thanks for taking the time to be with us today.
Sure. Thanks for having me.
Chris, I'm sure the coronavirus has decimated the tourism industry, and of course the tourism industry really isn't working at this point. Tell us a little bit about what's happening with the employees and the businesses right now.
Well, unfortunately, as you know, I mean, this is an unprecedented time for our industry, and many of the industries are just trying to survive the next 2 weeks, the next week. We don't really even know what the time period is. So unfortunately, there's so much uncertainty and fear right now, especially from our feeder markets that seem to be hotspots, that we just don't know what the next steps will be. So we're trying to plan the best we can based upon the information as we get it. But unfortunately, there has been a lot of unemployment. I don't think we're the only industry that's really feeling that right now. It's a trickle-down effect of all the industries that are interrelated here right in the Poconos. And we speak to a lot of folks across the country who are also associated with tourism, and they're absolutely seeing the same thing. In fact, some cities are in worse shape than we are, such as Philadelphia, because they depend solely on convention business, or it's a large part of who they are. So they're seeing it as well. So it's not only related to us.
Yeah, it's kind of everything, everywhere, new territory for everyone. And I think the most important thing right now is just to not let people panic. We all need to stay calm. And I know there are a lot of rumors running rampant. Is there any, I mean, we don't know what's going to happen from here, but how about hotels going to be used as hospitals? That's one of the things that when people think about, that's scary.
Well, we haven't heard that officially. The state and federal government are asking for some feedback if hotels would be willing to do that. It's also happening in some other cities, I believe in New York and Philadelphia as well, especially the major metropolitan areas. I think in an abundance of caution, PEMA and the Small Business Administration are asking, can they use that if they would have to? I think a lot of colleges and universities are being asked the same question. And again, I think it's in an abundance of caution, and in order to be able to help out the health system to handle, the influx of what some of them are seeing right now.
Could you actually see some of the resorts in our area being used as hospitals if needed?
Well, I think it's really too early to tell, because PEMA definitely has some guidelines and they have to meet certain criteria. So I know that they have reached out with surveys asking if some hotels would be willing to do that. Mm-hmm. But again, they do have to meet certain criteria. So some may be much better than others. I would think colleges and university dorms are fairly well set up for that purpose. I'm not a physician or in that industry, so I can't say. But again, there are criteria and guidelines that they would have to abide by in order to be considered for that. Hopefully we're not going to see that and get to that point. But again, I think it's in an abundance of caution.
I think it boils down to that this is an idea time. Since this has never happened in our lifetime, this is a time when ideas are being generated, and what can we do if we're called upon to do it? Is that what you're thinking?
Right. I mean, then that's in our industry, we're obviously hosting guests. The industry is used to having hundreds and thousands of people coming in and out of their properties every day. So from the surface, if I were in PEMA, that would be a good, obviously, use, I think, of our properties right now. However, again, we have no clue how long this is going to really take from start to finish. I mean, there is information from Europe, from China, and how their curve is really being flattened and extending. So that's the data we're really looking at right now. So if it's a month, and we start to see a reduction in cases, if our health system can handle it, that's how we all begin to start to recover. And that's, I guess, from our industry, that's kind of what we're hearing the most of. The uncertainty is, when will that curve start to flatten, and when will we start to see recovery?
What kind of a plan do you have in place? I know it's probably a little premature, but at some point when businesses are allowed to reopen and the hotels can reopen, is there a plan? Are you working on a plan as to how the resorts will come back online?
Yeah, so right now we're responsible for marketing the Pocono Mountains. So we're keeping our finger on the pulse of what our members are doing, our member resorts, and all the other businesses and attractions related to tourism. So some will obviously be able to come up faster and begin operations more so than others. So we're keeping an eye on that. We're also helping them to try to get the information that they need to be able to do that. And then also we're trying to craft a message from a marketing and advertising standpoint in the short term as well as the long term. So the short term we're defining as 2 months, and then the long term would be past that 2-month period of time. What our message will be, how we'll entice guests to be able to come back and visit us. I mean, this industry is a $4 billion industry for the Pocono Mountains, and I think we've always in this industry tried to really convince the state of our importance, and I think now they're absolutely going to see how important our industry is. So we're starting to see some indications that the state as well as the federal government will be supplying some stimulus that we've never seen in our industry before for destination marketing organizations, although we're not sure of that. So I think they're starting to see that now we're transitioning more so into a service economy, and it is driving our economy in a very, very big way, because when it's taken away, now obviously they're seeing that there's revenue that really is not there. And of course, it's an employment picture too. So it's not only a state revenue and local revenue picture, but there's a lot of folks, unfortunately, right now, they're unemployed.
Chris, do you see, and again, so much of this is premature, do you see the possibility that some of the resorts and some of the things in the Poconos may not be able to reopen when all of this is said and done?
I don't think so. If you look at the history of the Pocono Mountains way back to the 40s when we were the honeymoon capital, we've had periods of time that have been more challenging than others, but we've always come back very strong because the industry has been resilient and it's been able to rebuild itself. It went from a honeymoon capital to the champagne towers and the heart-shaped tubs, and we've always had a strong outdoor element in skiing. That's always been here. It's been built up over the years. And now with the water park concentration here, I'm fairly certain that our industry is incredibly resilient. I'm very bullish on that there may be a short period of some anxiety, but I know that we'll come back very, very strong, because we have a feeling that folks will be looking at hospitality and vacations much, much differently than what they did before. I think they'll be taking more advantage of them. I think they'll stay closer to home. That could be very positive for us in the short term. Our outdoor facilities are amazing. They're healthful. It's great to be out in the clean air. I think those are going to be really strong positives for us as we go forward.
How fast, Chris, do you think you could bounce back from this once you're given the go-ahead?
Well, it's interesting. Now, this isn't like any other recession that, first of all, I've seen in my 30-year career. I've gone through 9/11. I've gone through the financial collapse of 8 and 9 and many recessions. One thing I can tell you is recovery is always faster than what's projected. And the good news about where we were before this happened was we had very low unemployment. We had a very strong economy. We were one of the fastest growing tourism areas in the state for the past 3 or 4 years. So I have a feeling that what they're saying is it being a V-shaped recovery. I think that's absolutely going to happen. I think we're going to see a strong uptick very quickly. Our group and convention business will probably take a little bit longer just because of the logistics of that. But I think our what we call transient business or leisure business, the folks who just drive in from a destination and decide to stay the day, I think we're going to see a very strong uptick in that very quickly.
Yes, we certainly look forward to that too. It will really be exciting to see people discovering their own backyards if they haven't already done so, because we say that all the time, and now people really are staying close to home. And now's the time that, really once we get back going, I hope you're right, and I hope people do stay in their own backyards and support their local businesses. Chris, thank you very much for spending some time with us today.
Thank you so much. Have a good day.
We want to thank everybody for taking time out of their day today to be with us on our special virtual town hall meeting.
And be sure to watch the news tonight and every night, Pocono Valley and Night Report, only on cable.